So thank you to the efforts of the people that put this together. And David, I'll get you just perhaps, if you wouldn't, you can share your screen now, and I'll just go through. Thank you. And you may know, if you've been very used to Zoom, you can make there's a double vertical line in between the gallery of people and the presentation. You can actually move that across if you want to as well. So we'll just move to the next slide and just have a talk, as just to say that we are going to do questions via chat. And if you're not so sure about it, of course, you can open the chat window just by clicking on chat, and you can put to everyone and we'll see it. Or if you've got a really special question you don't want anyone else to see, you can just put it to myself or Mark, and that'd be great. Thank you, David. So just the other thing, a few disclaimers. Seeing we're recording this too, we better say this. We're not talking about a Rotary policy tonight in regard to COVID-19. What we're talking about is to cover off on the state government's health orders and how they can affect individual clubs. And as such, we've prepared this in the best way we think we could, with being appropriate, and where necessary, we suggest you actually seek independent advice if you're not quite sure. District 98220 and its officers do not endorse or approve, make no warranties, representations or undertaking, and there's no steak knives at the end of this. What we'll do now, I'll get David to kick off this. We've got probably about 20 minutes of presentation, just going through the key parts here, and we'll come back to the panel after that.
Okay, thanks, Tim.
Thanks, David.
Good evening, everyone. We'll start off with the first one, which is, so why are we doing this? Well, because of the various health orders that have been issued by the state government, we thought it was appropriate to sort of go through these and have a look at the various activities of the clubs and the district to see how that might impact on them. So we need to look at our various activities and determine who's responsible to ensure that the health orders are met. Now, we're talking about the health order, which specifies, you know, work, volunteers and attendance, that you need to be vaccinated, double vaccinated. And for most of these things we're talking about, you must be double vaccinated to participate in certain activities. So select workers, including contractors and volunteers and students on placement, are required to show evidence of vaccination to their employer, and if they don't, they must continue to work from home. If you're working in particular industries, there's particular requirements that you may need to be mindful of, but I'm not going to go into those. But the one that we're going to concentrate on is the fact that volunteers, which picks up most of the Rotary activities, although there will be some clubs that will actually employ staff, and we can tackle the questions around that a bit later on. So I thought it was appropriate to look at the club activities as I think they fall into certain categories. And the first one is the club meeting. And again, clubs will meet in various forms. I'll go into that in a little bit in the next slide. We've got project activities, a range of those. We've got fundraising activities. And of course, we'll have social activities or interactions. And each of these have different requirements under the health orders and also who's responsible to ensure that these health orders are being met. So we have a look at the activities, and we'll start off with the club meeting. For a lot of us, we just attend a venue where we have a meal and we have a meeting. That's not a particular problem then. It's the operator of the venue that has the responsibility to ensure that the health order is met. But there may be some clubs that are slightly different. And we'll tackle that in a minute. But now you'll have the venue operator that will be ensuring that that you log in, you wear masks indoors and social distance, etc. However, where a club hires a venue and they are then therefore responsible to ensure that the health orders are being met. And you will then need to ensure that you know the vaccination status of the people that are attending the meeting. And I'm suggesting there that you probably need to put in place what we call a COVID plan, and I'll cover that a bit later in the presentation. Projects, and these will vary widely amongst clubs, but generally I think it will be the responsibility in all cases for the club to ensure that the health orders are being met. I can't think of occasions where that won't be the case. You'll have, and again, depending on your activity, I think that you probably will need a COVID plan as well for that project. Next one we look at is the fundraising activities. And again, it depends on where this is being held. You know, whether you're hiring the venue or you're in a venue that's operated by someone, whether you're indoors, outdoors. So all these things will need to be taken into account when you're determining who's responsible for ensuring the health order is met. The typical one, Bunnings, you'll find that those clubs that have already done Bunnings barbecues, that they've already given you directions as to what they expect on the day. And also you might find that in certain areas, local council will have another overlay as to what they expect. So you need to be mindful of that. Social activities. Again, if you're out in a pub, a restaurant or something like that, where you're being looked after, it'll be the venue operator's responsibility to ensure that the health orders are met. Again, if you hire a venue or you're at an individual's facility, the responsibility will fall back to the club. And again, it's suggested that you'll probably need a COVID plan for that particular activity. Other considerations for clubs and district, of course, are training activities. You know, for instance, we're going to be holding a Rotary leadership sessions coming up. We had to go through and ensure that we came up with the venue, we're hiring the venue, had to ensure that we were conforming to what their requirements are, but also that we had a plan to ensure that we covered off and to ensure that the health orders were being fully met. Record keeping. Again, where we're talking about the club has the responsibility for the ensuring that the orders are met and thereby ensuring that they're getting the actual vaccination certificates. We're suggesting that, you know, the priority should be around privacy on these. And our recommendation here is that the club protection officer is the one that actually holds these, and the only other person that has access to them is the president as needed. The same as what we do for the youth protection declarations. For people or clubs that have regular events, it may pay them to look at the registration or taking out a registration to ensure that they've got a QR code. Again, that depends on, you know, the frequency of the event that you've got as to whether that is necessary. Um, other than that, rather than having people rocking up on the day and trying to see whether or not they're covered, I suggest that you have a roster for your event, and that you ensure that the members that are attending, you've already got their details before the day. What do you do if a Rotarian refuses to be vaccinated? Again, it depends on whether they have a medical exemption. If not, they cannot participate in the meeting, the project, or the social gathering. From a club's point of view, you need to be mindful of the anti-discrimination law. And so for where you have a meeting and someone can't participate in that meeting, we're suggesting that you should offer an alternative, and the alternative would quite logically be that they could attend via Zoom. I spoke about the COVID plan before. Some of the things that you need to cover off in your plan: you need to determine whether it's indoors, outdoors, because there's different density limits that apply. Whether or not you're in the activity is retail activity. If it is, you need to be mindful of the particular requirements that that must be met in respect to that. What you're going to do around the check-in arrangements, how the vaccination status will be checked and recorded, and whether or not you're going to have marshals there to collect the information, ensure that mask wearing is occurring indoors and social distancing is occurring. You need to look at the cleaning and other specific activities as identified. I look at this plan as just being a risk management plan, the same as what you do for your activities currently to date for Phil. You're just adding in that you're covering off on the COVID activity or the COVID risks in your plan. So what I'm going to do now is we're going to go to panel discussions. And the way in which we're going to do this, we're going to pick the questions up from the chat function. And I'm going to ask Mark and Tim if they could read those out, and then the panel, which will consist of Tim, myself, Chris and Phil, they can determine who wants to answer it. Once we've got through the chat functions, we can then take questions from the floor by just using the hand function on the Zoom function. So, Mark, Tim, have we got any questions today?
We do. Would you like to unshare your screen now?
Yeah, okay. I'll
Thanks,
stop
David.
sharing.
Yeah, and thank you very much for that. That was very informative, and appreciate the work that's gone into that. And Chris Drennan, our our district legal advisor, did have a look at all that too beforehand. So thank you very much for that. Now, what I'll do, yes, look, we've got a couple of questions. I think the first one by Phil might already be answered, but should we have a club QR code for check-in? Who'd like to answer that? Would you, David or Chris?
You can certainly register with the state government for a QR code. It's a matter of whether or not you're big enough and you think it warrants it.
Okay.
Certainly, if you've got regular events like market days and things like that, I think that the club should be thinking about it. But
I would concur with that view. For example, Warragul has an annual art show. It would be advantageous to have a QR code system in place because that runs over a week to a week and a half. So in terms of for a weekly meeting where you're going to a restaurant or another facility, that facility will have the QR code in place.
Yes.
Hello. Can I speak, please?
Can we
me?
just, sorry, I think what we'll do, we'll just leave hands up to the end. We've just got a few things there. Is that all right?
No, I'm not.
Thank you. So
Okay.
the other question, Bonnie Walker asked, is Zoom satisfactory for an office bearer? In other words, if they're not, I guess is what's saying they can't make a meeting for the reason they're not meeting the requirements of the COVID policy. Chris, what would you say about that, perhaps?
Well, it's going to make it very hard. Interestingly, we're up to number 5 version of the health orders, and that's in place for another couple of weeks. I'm going to predict, and I'm not very good at tipping as my reference to Tuesday would go. The further we go along and the more or the higher the vaccination rate becomes, I think the government will then start to reduce restrictions and requirements. And also because in November next year, we have another milestone event, which is a state election. So I predict that restrictions will ease, requirements will ease as we get very high up the totem pole.
Mm.
In terms of board members, if they're not double vaccinated for whatever reason, it's going to be very hard to participate in an in-person meeting. And I can clarify in terms of Warragul, before the last lockdown, we had a meeting and we tried to Zoom in one member who had gone to New South Wales for a mother's funeral and was stuck by the border lockdown. And it didn't go very well because people kept moving. So it's going to be very hard physically to run both an in-person meeting and those via Zoom or any other social platform. Can try, but I can't see that as a long-term option if my prediction proves incorrect.
So,
Thanks,
Chris,
David.
one question there. I think that the Incorporation or Consumer Affairs have said that the Incorporation Act allows for online meetings, board meetings. So I think, so legally they could probably do it. It's whether or not
Well, that's there's a fundamental difference. I thought we were talking about a board member who can't attend a club meeting. Personally, I love board meetings via Zoom. 1, don't have to drive there. 2, I can do it from home. 3, I can turn the video off and go to the bathroom and no one knows. Because yes, I am on the board at Warragul. So I love Zoom board meetings. Tomorrow morning, I've got a mediation conference. It's via Zoom. It's great. Otherwise, I would have had to go to Melbourne. So the difference between a board meeting and a club meeting is fundamentally different. Board meetings, yes, I would recommend if there was a board member who couldn't be vaccinated for whatever reason, yes, Zoom or any other platform is appropriate to keep the club functioning.
If there's any more questions after that, we can add them on later. So Veronica asks, what happens once the state of emergency is no longer in action?
That's a little bit like how long is a piece of string. I think we just have to sit back and watch. We'll know more in the next 2 weeks because the current health orders, and I've got them up on my screen, they're due to expire, I think it's the 18th of November at midnight or 11:59. So we'll have another direction one way or the other. And don't forget, we've got an Act of Parliament that has, it's a bill at the moment. It's gone through the lower house and will be subject to, let's say, scrutiny, for want of a better word, or pork barrelling for the independents in the upper house. So that might have some bearing on it. If that gets through both houses of Parliament, there's nothing to stop the Premier and the Health Minister from making a declaration straight away. But again, politically. We've got an election next year, so it'll be interesting to see how it goes.
Very good point, isn't it? The other question we've been asked is, do we have a pro forma for a COVID plan? And I would say the answer is probably not yes at the moment, or...
No, it hasn't been updated to fit in with the COVID on that, Tim.
Thanks,
I've
Phil.
got a note to look at that.
Yep, great. Look, there may well be clubs that have done something, and maybe we can ask them to share through myself or someone else. We can put up their email addresses a bit later. And if you feel that you've got one that might be doing, I know many clubs have progressed on this, which is fantastic. And by the way, Mark Humphreys, past district governor, immediate past district governor, has just popped up if you do want to create your own QR code and register with Victoria, the Coronavirus Victoria people, it's on a chat line there, and it's you can see that too. By the way, we will we're recording the chat as well, so if we've missed any questions or if we think there's something there that you'd like to have, we'll send that out in a couple of weeks with the link to this recording. So that's great. Plus, if anyone wants to share something, and I'm presuming, David, you're happy to share this PowerPoint if we...
I am, and the back 2 pages has got links to resources, including how to do that QR code.
Good on you, yeah. Thank you very much. So just going back to the questions, we do have quite a few here. We've got this lady, Jane Moore. Can you get a bottle of milk? Oh, no, it's not that one. If the social activity is in a private home with non-Rotarians in attendance, how do we ensure everyone is vaccinated? Think Christmas party.
I suppose the crucial aspect then is you have to determine, is it a Rotary function?
Yes.
If it is a Rotary function, then the QR code would be an excellent idea. And you probably should ensure that your club protection officer is invited.
Yeah.
Good point. Thank you. Anyone, David or Phil, anything you'd like to say about that?
No, I agree with that.
Yeah.
Good on you. Now, Chris, I hope Chris Such hasn't left yet, but he is it sufficient for the club protection officer to simply cite a COVID certificate, or do the personal details need to be recorded and filed?
Interesting one. I'm actually looking at an advice that was produced by the district legal officer for 9870, and we must be peas and pods because he grew up in Morwell and we went to school together. But Sergio gave a very, very good analysis of the public health orders, and he refers to the privacy principles, and he says that it would be necessary for members to consent to the collection of the vaccination status by clubs. He recommends doing so, and I would recommend doing so. I don't think it's just a good enough to cite, because I'm the club's protection officer at Warragul, and my memory is not that good. We've got 30 odd members, and I would prefer, exactly like working with children's certificates, produce a register that's not publicly available for the president of the time and the club protection officer. So, to be honest with you, I've got a vaccination certificate and I don't even know whether it's got an expiry date on it. It was hard enough to get it to work in with the government app, let alone doing anything else with it. But so no, I think it's more important rather than citing it, because that puts the emphasis then on the memory of the club protection officer.
Yeah.
And for all club protection officers out there, that's a pretty big burden.
Thanks.
I think it's interesting. It's coming back to the risk management again, isn't it? It's and it's just another layer that we've got to add to our documentation and processes, because that's the times that we're in now.
Sure.
Wholeheartedly agree.
Thank you. And Paul has asked a bit like before, does the district have COVID plan templates for, say, festivals, street stalls, and if not, could they develop them for club use? Is that something, well, I think
It's probably appropriate now to look at some of those risk management documentations. Yeah, I think it's something that we do need to incorporate and just look at the variations of templates for the more hazardous type, or call it hazardous, more difficult events to control, things like the Holland Festival and things where you've got substantial number of people coming through. So I think, yeah, we need to be developing it going forward to give clubs an understanding of the minimum requirements. It'll be similar to the current risk management for events anyway.
Thanks, Phil. Yeah, good. Thank you. Libby Wilson also pointed out that you can also attend a board meeting by phone or vote via phone according to advice. And that's fine, yes. I don't think Chris was saying you couldn't. I think he was saying more it's going to be very hard to manage. Would that be right, Chris?
Yes,
Yeah.
wholeheartedly. The one thing we don't want to do is ostracise club members, especially with the, I'm going to use this term liberally, the decline in membership across this district and our neighbouring district. So the one thing we don't want to do is ostracise members, but we need to encourage members to try to do everything to make it easier for clubs going forward.
Yep. Thank you. And Judith asks, would we need to collect COVID certificates from volunteer workers in our op shop?
Now you're touching on a little bit different area from the club perspective. My view is yes, because they're a volunteer, but they're also could fall under the definition of worker. The actual health orders do not define the term volunteer. My previous club in Melbourne has 2 op shops, and in order to cover yourself, I haven't been asked to advise, they've got other lawyers in that club. Yes, volunteers should be providing proof of vaccination before they attend what we would call the workplace. So it's no different.
Yeah, particularly when it's considered retail, which
Correct. That is.
Well, they'd fall under the liability policy, so they would fall under the, I think, all the controls or the risk management that are in place for a particular or any project.
I agree.
Thank you. And Carol says, I've been to numerous venues and all I've had to do is, she means her vaccination certificate is on the government app. And I guess you just check in, Carol. Is that what you're perhaps saying? Do you want to unmute yourself, Carol? Have I got the question right?
Yes, I meant to say show. I said how. Show. All I've done is I've just showed my app, which has my vaccination certificate, little green strip on it, and I've been able to get in anywhere I want to go. So I don't think we have to actually physically see the certificate. All we need is to show the app.
I think when you log in with a QR code, it flicks through the vaccination certificate, and therefore the particular venue knows that you are double vaxxed.
Yeah.
So I think, Carol, just by way of clarification, the earlier question related to the production of the vaccination certificate for the club's protection officer. Now, that would only be required if the club was the hirer of the venue or for any other social or fundraising opportunities. If your club meets a local club, pub, cafe, yes, QR code, sign in, automatically has your certificate. So it's a little bit different. So what we're trying to, well, from my club, what we will do is try to avoid any embarrassment by a non-vaccinated member trying to access a meeting when they can't do so, where it would put the provider at risk.
We have one member who's required a leave of absence because he's not going to get vaccinated. So we'll just provide that leave of absence for him, and he'll come back when and if he can.
Thank you. Thanks, Carol. And Phil McMillan says the VicGov does have them, which I presume he's talking about templates for business. He's got one for his business for a COVID policy, I think. Just, is that what you're talking about, Phil, if you want to unmute yourself? Phil McMillan, that is?
Yeah.
Meeting. I'll ring you back. Okay.
That's Phil.
Yes. So, Tim. What actually happened to me is some health department inspectors came into my business and
Rightly
had a
so
look.
too, Phil. I would too.
I'm on air, yeah.
Yeah, go for it. Sorry.
Yeah. Okay. So came into my business and we sort of had something, but it wasn't quite what they wanted, and so they gave us straight away and said, okay, look, this is on the government website and you can just grab that. And we virtually just had to put our name and a few things on it, and that had a few things. And so I haven't looked into it yet for the club, but certainly that's on my agenda at the moment. And I'm planning on having a QR code for things that aren't at venues and that sort of stuff, just so I can control things a little easier and have a little bit easier records. But I'm pretty confident that the Vic government website will have a basic template for a QR code that a club could grab hold of. Certainly that's what my business has done.
Thanks, Phil. We'll get Phil Thurgood to have a look at that too, and he might be able to spruce it up a bit. Thanks, Phil. Thank both Phils, really.
Yep.
So the other interesting, this is probably where we're getting to the nitty gritty. Lachlan asks, so just so I understand, the COVID certificate should be kept on record only if the individual consents. And what happens if they say no?
Well, it's like anything. We're not mandating anything here. It's just that you can't participate in the activity if you don't produce the certificate.
Cool.
So it's a bit like we don't mandate that you have to have working with children and the volunteer declaration form, but if you don't, you can't participate in youth programs. Same as if you haven't got a license, you can't drive a car.
Sorry, maybe I should just rephrase it a little bit. What I meant was more so in terms of for the record keeping. So like at an event, if they were to produce it, that would be okay. But it was just the statement was that the club's protection officer should hold on to a copy of it for the club.
Well, if the club is responsible for the activity and they've got to ensure that the order's been met, you need a record. So whether you do that via the registration through with a QR code, where you don't do that, you need to keep the physical copies. And what we're saying is that if we get those once and are held by the by the protection officer, all they then have to do is provide a register to the president, and he knows who can participate in activities. So they're only held by one person.
Yeah. And there it becomes very awkward for clubs, doesn't it? But we can talk a bit about that later. So also Tim Wills says, I'm aware of a couple of clubs which have a designated COVID response officer with special tights and uniform. Oh, no, he didn't say that. This covers who should be responsible as well as present, not so always the protection officer's responsibility. Thanks for that. Libby Wilson says they don't fall under retail workers. Is that volunteers, Libby? Do you want to unmute yourself?
Sorry, I was saying, don't they fall under retail workers?
Oh, don't they fall under?
Yeah.
Sorry, I was.
We're treating ours as retail workers, our volunteers.
Thank you. Yeah. It's a bit like that old Benny Hill thing, isn't it? You know, look on the road ahead. Anyway. So Graham asks, please confirm, people attending an outdoor market, do they need to be vaccinated?
Well, again, it depends on who's responsible for the market. If the Rotary Club are they the actual responsible party, or are they just participating and doing certain activities on the day? So you need to determine who's got that responsibility. If they have got the responsibility, it depends on what the health order is at the time. If the health order specifies that people coming to the market must be double vaccinated, well, you need to ensure that you've got someone there to check them in.
Mm.
Tim, could I have a word, please?
Yes.
Yes,
Please
Tim,
do.
look, I'm from the Rotary Club of Druin, and we do the Saturday market, the third Saturday of every month. I'm their director of COVID support. Our requirements are that all our volunteers must be double vaccinated, and the same applies to all our stall holders. That does not mean the visitors as well. We do have a special QR code, by the way, for our Rotary market. It's determined by location. Ours is at Civic Park, but we have another one that we have applied for to VicGov, and that is a QR code that we can use at any venue that does not have its own designated QR code. In other words, if we have a Rotary function somewhere and they don't actually have a QR code, we can use that one. Otherwise, we simply use the venue, say for our Tuesday night meetings at a restaurant, we use their QR code, and then we use the specific QR code for our Rotary market. And that's
Thanks, Rob.
the current legislation. I've had a rather in-depth meeting with the VicGov people over Zoom, and we did have a talk about it, and that is the current law at the moment from Victoria government. However, as a Rotary organization or any other organization, you can make up your own COVID rules, providing they are not in any way less than VicGov's rules.
Mm, mm.
That's the current legislation as of a few days ago.
Thanks, Robert.
Okay.
David or Chris want to respond, or you're happy? I think he's given us all.
No,
the
I
colours.
think Robert spoke very, very well. And I'm just assuming, Robert, that you didn't even lean on the couple of lawyers in your club that I know.
Thank you very much. Now, Bill Young has said in Phillip Island, do we need to cite each time or one time or hold a record copy of that certificate? I think we may have answered that one, Bill, that we recommend a recorded, at least a record that you've seen it and cited it. Is that right, Chris, I think?
Yep.
Yep.
I'd agree with that.
And Libby Wilson, of course, Rosebud Rye have an op shop as well, an op warehouse. We note dates of first and second jabs, expecting that they will be a requirement to have workers receiving boosters in the future. Oh yes, that's going to change it again, isn't it? Viewing proof is not necessarily the same as recording the details. Yes, I think we've got that covered. Okay, I don't know if that's a question. I might just move on to a question. If a club hires a venue, would we be able to use the venue QR code, or do we have one of our own? I think we might have had covered that. Chris, would you?
Yep.
You'd use the venues basically in that case.
Yes.
Yeah, Tim,
Yes,
you
Robert.
use the venue if they've got their own QR code. If they do not, then you use the QR code that you have for those specific areas. In other words, anything that you don't normally use it for. If you run a market, as I said, you use that particular QR code there, but then you have a generalized one which you can use at any venue that does not have its own QR code.
Thanks, Rob.
Okay.
And Linda Humphreys, legally, there is a big fine if you don't follow the COVID regulations. How do you prove that you have followed the rules? Or maybe I'm reading this a bit wrongly. How do you prove that you have followed the rules by recording certificates correctly? Linda, do you want to speak to that? Sorry, I don't want to mess up your question. The Humphreys?
Sorry. I know, it doesn't make sense, does it?
I tried my best, sorry.
I guess because where I work, you know, we're very, I work for Shy, so I'm really quite up with all the rules. And I guess what I was doing is trying to answer the question that, you know, there's no point, you need to do the job properly, because it is a big fine if you do get caught with your pants down, basically. If you haven't got everyone covered, you've got Rotarians that are not fully vaccinated working alongside, at an event, you're going to have problems. So you just really need to make sure, and it's quite easy. It can be done very well with quite a lot of discretion. You just ask people to forward their information and it's recorded. You then know who the people are who you can use. So I think it's just important because I think people have forgotten that there's a lot of money in the fine system if you get caught and you haven't done the job properly.
Anyone like to comment on that? David or Chris or Phil?
Very salient advice.
Yeah. And that's why I think that it's good to have your roster and check your roster so that you're not having these discussions on the day.
Yeah.
Yeah. The other point that I think we should make here is that this is the health orders as they are today. So clubs have got to actually watch and see when that changed. And as I said, and then you've got council that can come in and tighten things and ask for other things. So you need to be aware of those. So that needs to be part of your investigation when you're looking at your activity.
Thank you. Jeanette has asked, it's just the COVID certificate we need to see, not their overall vaccination. Oh, that's right, because I think someone else popped in that, of course, you can download your full vaccination history. We don't need to know about your yellow fever or anything like that. No, it's just the COVID one. So, but yes, you can collect that, of course. It's very useful, isn't it? In fact, I've created my own international one, hoping that I might be able to use it very soon too. You can generate that now. Now, I haven't got any more questions. Do you want to, look, we've still got a few minutes. I know we've hit it pretty hard and we're probably all going, my goodness, you know, we don't really need this. We're just volunteers. But in reality, we've got to do this right because, as you say, there's very big fines and risks, of course. We want to look after our members. And I've seen, I think the overall thing is that as a club and as a district, and that's why we're providing this advice, is that we've all really got to look after and give, with Rotary, we've got the highest expectations, very high ethics, and we want everyone to get the most out of their experience in providing help to the community and all that sort of thing.
Tim?
Yes, please do.
Tim, it's Dave Blythman from Traralgon Central.
Yes, David, go for it.
I'm sort of one of the coordinators for our district conference. And do we have to have vaccination certificates of everyone that's turning up to that conference? I know the rules are going to change again, and also the council will also put some conditions on it. But yeah, it's a conference we're all attending. So do we need to have proof of everyone that's attending that they're double vaxxed?
Well, I might leave that up to Chris. I think I know the answer, but
No, I think you'll find, David, that the answer is yes. And it would have been excellent with 2020 hindsight that with registration online, one of the line items could have been, please confirm that you're double vaxxed. But I think it's too late for that now.
Well, yeah, the registration forms were sent out in July, so we didn't know all that information then.
So yes, unfortunately, I'm not sure what you'll do with the QR code because the venue will have one.
Yes.
Whether you decide to do your own specific QR code for the conference. But again, that's not going to stop people sneaking past and not logging in. So yeah, it's going to be an element of trust and an element of cooperation with clubs. So perhaps you compile lists of registrants per club and then ask the clubs to confirm. They're not, you provide the names, the clubs can provide the response, yay or nay.
And if we don't get any response, what do we say to them? You can't come.
Then you will, well, what you'll do is you'll narrow down the number of people with questions or questionable registrations. You'll narrow that down considerably. And then if it has to happen, the district committee can then ask individual registrants to provide confirmation if the club cannot do so.
Chris, the other thing they need to watch out for here is if they're engaging any contractors. And also, I suppose you need to be mindful of your speakers as well.
Yep, absolutely.
I assume, Chris, if we don't do a good job of checking this, we would be liable.
Yeah, can I?
Yes.
Yeah, well,
The short answer is yes. And there are inspectors out, because I think it was Phil mentioned he was inspected or audited at work. My wife is a teacher, and I won't mention which school. They were audited. And it was unfortunate. There was quite a few people walking around without masks. So,
Thank you.
Yep.
Now, yes, we are going to, if you want to put your hand up in the reactions, there's a raise your hand, and I see Paul Rubens's hand. Go for it, Paul.
Yeah, just to address the conference question there, and it probably would go the same for the Holland Festival, is I just think that, say, taking the conference as an example, if it's well publicised that you must be double vaccinated to attend, and that there will be COVID marshals at the front door, all you need do no more than see their green their certificate on their phone as they come in, and if they can't show it, then they're told to go away. So I can't see that you need to do more than that. And the same with the festival. We might expect 5,000 or 6,000 people. We'll have 3 or 4 entry points. Everybody will know they need to be double vaccinated, and we'll have a couple of marshals probably at each gate to see that they've got that certificate. And if they haven't, then they won't be given entry. So I think it's as simple as that.
As long as you don't borrow someone else's phone.
Well, yes, I suppose.
Yeah, look, I know it's.
You can climb the fences as well, or get in. Look. Yeah, what I'm saying.
A good festival. Yeah, good on you.
And just make sure that your appointed marshals also have the physique of a bouncer.
Well, we will have paid security staff at least one at every gate.
Yeah.
Tim,
Thanks.
you can't use somebody else's phone. It names the person in the certificate.
As long as you know who the person is holding the phone, then.
Well, then maybe we ask them to show their driver's license or Medicare card as well.
Yes, it's look, well, let's face it, Rotarians would never do that, would they?
That's really where we're coming at, Tim. I don't believe the type of people coming to this conference would do anything that dishonest.
No.
I wholeheartedly agree.
I think the rest of it's almost irrelevant.
Is it the truth?
Is there any other questions? I don't see any.
Tim?
Oh, Phil, yes. Go for it.
I've just received today in regards to Bunnings barbecues, and some may have already carried them out and others will be coming up shortly. I'll just quickly read their comment regarding the COVID, and it's the Victorian government has identified certain workers who are required to have mandatory COVID-19 vaccine. Vaccine rules apply to all community volunteers operating the sausage sizzle, and volunteers are required to have at least 1 dose of COVID-19 vaccination by 22nd of October. By 22nd of November, community volunteers occupying the sausage sizzle will be required to be fully and double vaxxed. It is incumbent upon the community group occupying the sausage sizzle to manage this requirement to ensure that all volunteers are compliant for the duration of the event. Volunteers may be asked to produce evidence of their vaccination status by an authorised officer, as in police officer or a WorkSafe inspector upon request. So you can see there's timelines for a particular well-known Rotary activity. So that will, I think, be certainly a good starting point for every activity.
Thanks, Phil. Chris, any closing remarks?
No, I'm just pleased that so many members of our Rotary community have registered and attended tonight and participated, because dissemination of information is very important for our organisation to clear these hurdles.
Thank you, Chris. Phil, anything else you'd like to say?
Just a comment. I think overall we have an understanding that this sits in the risk management side of things, and I concur with Chris in that what the club is doing is endeavouring to bring the district into best practice. All these things are common sense, and we're just trying to apply that principle, I think.
Yeah, thank you. David, any last minute things?
No, only to say that a copy of the PowerPoint will be made available to all the registrants, and the back 2 pages, as I said, have got the resources where you can click on the link and it'll take you through to whether you want the health order, you want to see how to do a QR code or whatever it is. That I've got the most links are there. And I suppose the only other thing is that if you're stuck in your own shawl, feel free to come through to us, and if we don't know it, we'll tell you that you need to go and get some advice. But there might be something that we've already come across and we know what the answer is.
Thanks, David. Neil Heron has a question. Lucky last, Neil.
No, I don't have a question. I just thought I'd say that we did a Bunnings on the weekend and the police did visit. And we have a COVID register, so we had no issues, of course, but that reflects what someone else just said.
Yeah, thanks, Neil. Appreciate that. The recording will be available, Mark, of this session. And look, I know we've got a lot of people that haven't come, and they're hoping they are going to get the recording, which we are doing. Mark has put a link there if you know how to copy and paste, but we will put that into an email that everyone who's registered, plus all presidents, all district leaders, we won't blast out to every member, but I'm sure if you need it, someone will have it. So thank you very much, everyone. Governor Bill, would you like to say anything in summary? Sorry to put you.
Just that I think that's a very important subject, that we need to be conforming. As a Rotary district, we can't set the rules for you. Each club has to set your own rules, but please be cognizant of what the state health orders are to make sure that we are conforming with their requirements.
Thanks, Bill. And thank you, everyone. If there's any other questions, feel free to email me because I'll be the one sending out the information. I'd like to thank Mark Humphreys and Jane, and of course our panel, Chris, Phil and David, and everyone else for participating. Thank you very much, and we'll catch you again soon. Thank you. Bye-bye.
Bye.